When first there were we realised that actually, the death rate from COVID for certainly people under the age of 65, 70 was actually really, obviously worrying, but nothing like as worrying as we thought when this virus first hit Western shores. Then the concern moved on very quickly to long COVID, and there have been an awful lot of reports, and we know an awful lot of people say they've been suffering long-term symptoms, some incredibly debilitating. But the latest reports into long COVID from the Office for National Statistics say that actually more than half of Britons suffering from long COVID might not actually have it. They may just be suffering from normal bouts of ill health. And long COVID symptoms in children rarely persist beyond 12 weeks and is actually at a very, very low level. Well, let's talk about all of this with Ondine Sherwood, who's co-founder of LongcovidSOS, representing those who've been suffering from long COVID. Good morning to you, Ondine.
Good morning.
Morning.
How are you?
Very well indeed. Every time we speak to you about this, you pointed out, look, a lot of people do have very debilitating symptoms from this. And even if it's a very small percentage, it can still be a large number of people. But certainly this ONS study is saying that more than half the people who believe they are suffering from long COVID don't actually have the condition. We know that a lot of the people who do report the long COVID symptoms, and we'll go through the variety of those, and there's a big variety in a few moments, when there have been some studies that actually among the population who've not had COVID, a roughly similar percentage will actually report similar symptoms. So does this tell us that this is not such a big issue to worry about?
Well, no. First of all, I saw that headline yesterday that more than half the people who have long COVID never had COVID. This is not what the ONS are saying. The ONS used a control group, and in the control group, they showed that there were people who had never had COVID, had similar symptoms. Those people don't think they've got long COVID. No. They wouldn't say, "Oh, I've got long COVID," no, because they've never had COVID. This is a misinterpretation of what a control group is for. What I also want to say is that the ONS, first of all, have said this data is experimental. They've used two different approaches, and they've compared those two approaches with the one they usually use in order to calculate how many people have got long COVID and what the prevalence is. They've also said, we would advise users to interpret today's release and others about long COVID with caution because it's very difficult to measure. So these figures, first of all, if I may critique them, yeah. These two new studies are based on a basket of 12 symptoms. Now, how they reach these 12 symptoms, I'm not absolutely sure, but I will take this up with them because one of the problems is last June just gone, they listed 21 of the most common symptoms that people who have long COVID suffer from. For some reason or other, they have picked amongst the 12, the bottom 4, which include 3 gastroenterological type symptoms, which really we could be rolled into one. Yeah. As well as picking the bottom 4, they also missed out some of the major symptoms that people with long COVID have. They don't mention chest pain, tachycardia, neurological symptoms, which are very, very common. So they had to narrow it down in order to have a control group, because you can't ask controls, yeah, do you think you've got long COVID symptoms? Because they won't say yes, because they haven't had COVID. So
you're saying they're not really comparing they're not really measuring the range of symptoms that people can have. I suppose a lot of people would say, well, if a syndrome can have such a massive range of symptoms, is it actually one syndrome? Does long COVID actually exist in that sense, or is it just that different people's bodies react differently, and it may well not be a syndrome itself?
Well, that's a very good question. Certainly, yes, people's bodies react differently, as they do to COVID. We know that COVID is a multi-system disease, and it tends to get you where you're weakest. Yeah. So some people will have chest problems, some people have cardiac problems, but COVID is actually, many believe, a vascular disease. So it travels around the body and it does damage wherever it can. And so people with long COVID will be suffering from a huge rate. Now,
but we do also know, don't we, it's more likely that people have long COVID if they have actually been seriously ill with COVID, been hospitalised. But we also know that it's also more likely that is the case if you are obese. And a lot of these problems will, again, be tied into people's other long-term health problems, which were also among the reasons why they were hit so badly by COVID. Even allowing for the fact that, yes, there are still healthy, slim people who do get COVID and get it seriously. I do accept that.
A larger percentage of people who have been hospitalised will be sick for longer. But of course, if you look at the percentage who've been in hospital, it's quite small. So there are vast numbers of people who were never hospitalized who get long COVID, and many of whom were relatively young or quite young and fit. So yes, it's a whole wide-ranging disease. It really is. It's got a huge range of symptoms, and it's very, very difficult to pin it down. And to just pick 12 at seemingly random, I think it doesn't give you a particularly accurate picture.
Okay. But I'd say very good news that that actually children. I mean, lots of people. The arguments for jabbing children has been that children have can have a risk of long COVID, even if they're not going to die of COVID statistically. But actually, they rarely persist beyond 12 weeks, is what this study suggests. So that's at least good news. You query that as well?
Well, the clock study, which was published a couple of weeks ago, did find that 13% of children, and this is compared to controls, were getting symptoms. They didn't go much beyond 3 months, so we don't really have the data. But again, you're quoting data from these two, well, they called it sort of experimental studies, which I'd have to say.
The only thing in their defence, it is the OSS for national statistics, and also it's probably more accurate than people self-selecting for surveys and saying, oh, I think I've got long COVID. I mean, with all due respect to you on that, I would trust the ONS data more, but I do accept all of your points and your concerns about how they've decided to register and measure this. Ondine Sherbert, we'll have to leave it there. She's co-founder of LongcovidSOS. 8:42 is the time. Dave Chawner is still